For those just joining me, I am over in Newport Beach, California, and I am a specialist really in acne and scars and pigmentation. And that's what I do almost entirely at my practice. I also do a lot with collagen production. So I do a lot of collagen products such as Bellafill, Sculptra, Radiesse. I also do a lot with skin tightening. You can see that they all really go together. And a lot of times what I do is I try to showcase on here to really demystify the process for scars and how we could improve the scars. So I'm going to go through a process right now which has been a big topic of discussion, which is subcision. So I'll talk a little bit about subcision right now tonight, and then I'll also answer any questions that people have regarding the process and how I do subcision, which is a little bit different than a lot of practices, especially people who don't focus on acne scars. But I think that my technique is also even a little bit different from people who do a lot with acne scars. So I'm going to showcase that for you guys today, and I'm going to show just overall how I actually solve scars, particularly tethered scars. And what I'm doing right now, and you can see this process, this is really with subcision. So with subcision, you can see there's a process where we're going to really want to go inside and break up scar tissue. So that's what I'm working on over here, which is essentially where I put some fluid in the skin underneath the tissue, and that helps separate the scar tissue, those tethered bonds. And then I go inside with a tool. Usually I use a cannula, at least initially, just to help see how thick those scars are. And then if I need to, I could use other tools like a tailor liberator, or sometimes I use something called a Nokor needle as well. There's multiple different options really for subcision. It really just depends on how thick the scars are and really what we're seeing with that. What kind of fluid? No, so I don't use Radiesse. Someone's asking if I use Radiesse. Not for subcision portion of things. Really what we want to do with this is we use something called tumescent fluid, which is basically normal saline or water really, plus a little bit of numbing solution in there, some lidocaine in there, and then plus something called epinephrine, which will help with bruising and also minimize the chance of a hematoma. So I usually do that. I don't tend to put something like Radiesse at that time right there. So I don't usually do it at the time, but sometimes I do. It just depends on how much volume loss there is and what I'm kind of seeing as I'm going inside there. But if I need to, then I will do it. But usually the thing is that when it comes to filler and placing it the same day as what can end up happening is that it doesn't go in the layer that you want it to. So it's really important to make sure that it goes into the correct layer. If it doesn't, you could end up running into some risks where especially with Radiesse, it could, with gravity, go to a pocket that's a lot worse, a lot more superficial than you expect, and could pull down things a little bit there. So that's what I usually want to make sure that it's always in the right layer, and I tend not to do too many different things with volume while I do subcision. So I always say we're going to do some things with volume potentially if we're able to get away with it, but I can only do it if I really feel comfortable making sure that it's not going to the wrong pocket, it's not going to pull down the skin. Someone was asking about Nokor needle. So with Nokor, actually, that's a blade. I'll have to show you a little photograph of that, but sometimes you may see it in my videos. It's almost like it's basically just a blade at the end instead of just a needle. It's going to be sharper, and we could actually underneath the tissue really break up some of that scar tissue, especially relatively superficial pockets of scarring. And you can see those bonds as they're pulling down over here. We do want to go underneath there and actually break that up. So we could do that with a Nokor needle. And that works really, really well. But the thing is that, again, you want to make sure there's enough fluid, enough solution in there to really numb the area, because otherwise what could end up happening is that you could cause what's called a hematoma. So hematoma basically is something where you have this pocket, this collection of blood that's there, which ultimately could be really problematic, because then what happens is that could actually cause there to be that prolonged swelling could potentially lead to sagging. You know, it could potentially lead to sagging because of that swelling that occurs from a hematoma. So I'm very, very careful making sure that we're not actually doing this in areas that are tend to be dry. So I always want to do a lot of fluid, a lot of numbing there. I'm showing actually a diagram right here. I'm going to superimpose this over this slideshow so you can see a little bit of the, let me actually just hide a little bit of this right now. So you can see the layers of the skin. I want to showcase this for you guys because it is important just to be able to understand what we're doing when we're doing subcision, because this is something that I think a lot of people get a little bit mixed up on, that even people who are in the industry, things like that, they don't tend to know what layers we're doing this in. So I'm going to showcase this a little bit for you, the different layers. So most of my work is really within the dermal layers. So I'm intradermal. So it's papillary dermis and the reticular dermis. And each of those layers actually has a different feel to it. So as I'm going in there with the cannula, I'm really testing to make sure that I'm in the correct layer. I'm tenting the skin to make sure that it's a safe zone for us. You notice actually I try not to go too deep. I try not to go to that hypodermis. That tends to be an area where you could run into more risk. You could have fat displaced when you go there. So I try not to do it over there. But in general, we could do a lot of our work intradermally. So that's mostly what I do. But now there is sometimes where I may feel as if some of the bonds are really stuck and then I have to go into the epidermis area. So I'm going in the epidermis area a lot of times with something like a Nokor needle, or I could use even other gauges. I could use other needles. So I could use something potentially like a 27 gauge needle just to help break up the scar tissue. So nothing too big, nothing too thick, but sometimes just a little. In fact, I did that for my case today. I just used small little bits. I use a 30 gauge needle, very, very tiny needle, just to slightly break up some of that scar tissue. So it's really not about like this big, aggressive type of thing that you have to do. The other thing is I tend not to use much force. Almost never will I be using much force really to break up the scars. I'm really, really carefully, meticulously breaking up, nudging up the scar tissue and feeling those tethered bonds and slowly moving my cannula there to break that up. So I never really want to push it too much, because then I think you could run into a problem where you could go into different layers and accidentally. So again, we want to make sure that we're always in the right layer so that we could do this appropriately and safely for patients. So the biggest things are going to be making sure we're in the right layer and then using the right tool for the right layer. So if you're in a layer, for example, that you have to go a little bit deeper, I tend not to use those thick blades now pretty deeper. I think you could run into a lot more risk than that way. You could really end up shifting some of the fat. So I don't really do that really at all, where I use something like a Taylor Liberator very, very deep. But using a blunt cannula just along that dermis, intradermally, just slowly, meticulously breaking up the scar tissue. And then if it's stuck, then you may have to do something where you use a blade. Then that's a lot more appropriate because you're really fine-tuned and you're really precise at where you're going to be localized to. So I think that's a lot safer and ultimately gets you a lot better result because there's less swelling also involved too. So it's a little bit nicer for patients because the downtime is a lot better than it would have been if you did it without that. So you can see in this slide, for example, this is where we're using a cannula. This is a blunt tip cannula over here. So we're doing that. And then you can see this part over here. This is where we're actually have it tented. The skin is tented right there. So you can see that part. And you can see really nicely the process where we actually could go underneath that scar tissue and break it up really well. Someone's asking, is it painful? So no, it's actually completely, there's numbing everywhere throughout the whole process, so it's not painful. We really make sure it's really as comfortable as it possibly can. We have multiple videos where patients are live, they're sitting there, you could talk to them, interact with them, and they will tell you that it's not painful. So, I've done this procedure myself also. It's not something that's painful. I will tell you the things that are painful. This is really not one of those things that's painful, really. Do you have fillers in my cheekbones? Yes, I do. I have Bellafill in my cheeks. Let's see here. What would you recommend for hollow cheeks because of acne scars? So Bellafill works really well. Sculptra, Radiesse, those are all good options. You can even use fat transfer. Fat transfer is a really good option if you have a lot of volume loss. It's really, really good for that. Let's see here. The Michael Dewan is saying filler is not used during the same day as subcision. Would it be a different session? So sometimes I do filler, not to be mistaken. I do sometimes do it. Sometimes it just depends on the layer that I have to do it and how much volume loss there is. If I'm comfortable enough that's not going to shift or anything like that, I want to make sure it's exactly where I want it to be, then potentially I could. But that being said, you know, a lot of times I do space it out. I want to make sure when I'm looking at patients, okay, I'll tell you honest truth. I do a lot with filler, actually, a lot. I know I do. I focus a lot on here about scars, about pigmentation, things like that, because I think there's a lot of people who also educate about filler, and there's hardly anybody who talks about the process for scars or anything like that, and just makes it really accessible for people. So I try to do that, but I do a lot with filler in my practice, actually. And I really pride myself on making sure that it's really natural for patients. I really want to make sure that as they're animating their face, as they're smiling, it looks and feels natural. That's really, really critically important for patients. So, and for myself, I want that. So if I'm walking around and I see you guys, I'm going to feel comfortable and happy that I did that work. You know, and sometimes I run into people at the grocery store, things like that. And I want to make sure it's really something that I'm really proud of, that this makes a lot of sense, that you look great, you know, and that's what that I hope to achieve every single time. So when I do filler for scar patients, it's really you know, a similar type of thing in terms of natural look. Initially, though, what I'm trying to do is I'm trying to target just the scarred areas, the areas that you lost volume due to scars. And then if you're interested in it, then we could do more facial balancing, facial sculpting, things like that, if you're interested in it. If you're not, totally fine. That's okay. You know, everybody has their own preference. But you know, I'm very, very excellent at making sure that we can keep it natural. That's all I care about. I want to make sure that it looks natural, and it's also, of course, a really great result. So we could get that, especially with collagen stimulating products, I think. Dindin is saying, can I combine TCA cross with fractional laser on the same setting for Asian skin type 3 to 4? I do. Pretty much every day, one of our patients is of Asian descent, and I almost always, especially the first session, combine that with a laser. So I usually want to smooth down the edges of the scar while I'm triggering a collagen response deep. So I do both of those together. Anita saying, great result. Did you do any other procedures in this case? Yes, I did. So this patient, she also got dilute radiesse. This is actually a case of dilute radiesse as well. TCA cross, we did laser resurfacing. So we did all those actually for her. I haven't seen her in a few years. We actually were doing a study for Subcision, which we submitted for publication. And we happened to go back and reach out to her, and she let us share a photo now. But we haven't seen her in a couple of years actually. So hopefully, she told me, she told us when we talked to her, when our research team reached out to her for the study, she said her skin's looking great. She thinks it's looking even better. So hopefully we could be able to see this. Is this a new method that I'm using? No, this is what I've always done for Subcision. I've always done it this way. So nothing particularly new with this way. I think that this is really excellent for that. Carlos is saying, hi, Dr. Qazi. What if you have a lymph node in the cheek? Will product take it away? I guess you'll have to ask, what do you mean by lymph node in the cheek? Everybody has lymph nodes in the cheek. What do you mean by that? It's a large lymph node. What do you mean? Do you recommend anyone in New York City for this? I can't say that for sure. I would have anybody that I would know. There's very, very few of us in the world really who do this like this. Do you do topical numbing? So actually, good question, actually. Let's talk a little bit about topical numbing and why I don't do topical numbing. So today's case was actually, I had two really good cases, actually. Both of them, similar issue, where essentially there is this large area outside of the scar. So sometimes you may feel like there's these rough edges of the scar. And what happens is actually the scar tissue over there tends not to get broken down by traditional lasers. So you'll see me use a focal high energy amount of laser to really smooth down the surface of those scars. And that's something I really, really pride myself on, really focal spots, going really strong, smoothing it down. And now when I'm doing that though, I have to make sure that of course we're in the safe layer, we're not overheating the skin. It's really focused on those spots. If we're doing it on patients where they have had some topical numbing, sometimes what ends up happening is that the scar may be masked a bit. Sometimes there's a bit more swelling than you may expect. Sometimes actually when you're doing TCA cross, it's not going to be as deep as you may want. So there's a little micro swelling that happens when you're doing topical lidocaine, topical benzocaine. So occasionally, that could mess up my scar results because I'm trying to be as precise as possible when I'm doing TCA cross and I'm doing the laser focal spots around the edges of there. I really want to make sure that's exactly accurate. Nobody ever complains of pain for us, because pain is completely under control. We do nerve blocks. We do, with this Subcision portion of things, there's so much fluid and there's so much numbing medication in there. Nobody ever says that there's much pain. So really, and again, we have so many live videos showcasing that for people, so you can see all the time. Amisaid saying, hey, awesome insight. Awesome. Hopefully I can help you out with everything. Misha saying, is cannula required on rolling scars as well? Yeah, usually it is required. Bao Kimi saying, do you recommend finishing 3 treatments of a cure before starting a treatment consult with you? Yes, I do recommend getting that under control. Control your acne first, then we could go ahead and talk about this. In fact, the patient today that came in today, she was someone who did a cure 3 months ago. Skin looks amazing now. We're going to be close to doing scar treatments now. Jay DeRay saying, hey, Dr. Qazi, had a consultation with you for some extensive treatment. I'm planning on coming early next year. Most of my acne scars had come from folliculitis. I remember, Jay. Look forward to seeing you, though. But you have another question. It says, I've read some things that said that lasers can potentially damage hair follicles and make folliculitis worse. Is this something to worry about? Not quite with the way the lasers we're using, but some other lasers could potentially do that. Not Jay. We had Jay over there. Now we have not Jay. Will something like Subcision help with smile lines? No, you don't do that for smile lines. You could do that for forehead lines. A lot of times forehead lines are actually really stuck very, very deep. So you do want to break up that line. And that's actually that really is almost like a scar that's formed over there. So sometimes we do subcision in there as well as filler over there. I do a lot with forehead filler, actually a lot of forehead filler. I sometimes don't show it on here because it is a high risk procedure. I think that people should take it very, very seriously. I do it very, very safely, but people may not understand what layer I'm in as I'm doing it. So just so you know, there is a way to do it really safely, and it's great for the right patient. Boo is saying, my husband said had laser with you, said it was the worst pain he ever felt. Boo, I'm sorry to hear that. I've never heard anybody say that they had the worst pain. I have so many different ways of doing numbing. I have tons of different ways. I will say men sometimes don't tell me when they have that much pain initially, and then I keep on asking, so I'll have to double check to see. But there's a lot of different ways. We have a lot of numbing solution to be able to put into people. So yeah, you know, I feel like that's something that I would love to be able to hear back from him at some point, just to see exactly what happened there, because I would be able to constantly be able to put a lot more numbing solution on anybody. And that's what, you know, we do these live videos all the time showcasing the process just for that purpose, so that there's, you know, people could just ask people and see what the pain is like and everything like that. What's a treatment recommendation do you recommend for melasma and pigmentation? I recommend Pico laser. That's really one of the best options. I do a ton with Pico laser. It really does break up the pigmentation, and it's really nice because over time your skin quality itself gets better and better and better. So that's really, really nice because there's a bit of a skin tightening process with the collagen response that occurs with there. And Sticky saying, is there an option for using PRP instead of fillers? So it's not about doing it instead. PRP is a very different process. PRP is really going to actually help with bringing new blood flow there. It's going to help with the healing process, but it's not really going to help with scars. I did a lot with it before, but it doesn't really change really for the scars themselves, but it does help with the recovery process. It does help with that actually really nicely. NB saying, does Bellafill migrate as you age? Well, it moves just like your regular natural skin. It doesn't actually migrate, it just moves as your skin. Would you work with a patient that prefers not to do subcision filler? Well, if they need it, if they need for the rolling scars, probably, you know, we'd have to have a talk about that, really, because especially if you want the best results, we'd have to see with that. Carlos is saying, does that filler and scar tissue loss go away? Typically not. It usually stays there, integrated there for Bellafill. It will stay there. Hello saying, when you do combined treatment, do you laser the whole face or just the acne scarred areas? I do mostly where I do a stronger form of the laser along the scarred areas. I don't believe in using intense laser all over the face for scar patients. I'm usually using it focal spots, and then what I end up doing is I do a blended form of the laser elsewhere. Yellow saying, hi Dr. Qazi, I'll be seeing you this Friday. Awesome, Yellow, look forward to seeing you there. Smiley is saying, how does fluctuating weight loss gain affect Bellafill? Good question. It's just like your natural tissue, so it could pull down just like your natural tissue, just like if you lose weight, like your regular skin, it's going to look and feel just like your real skin. So it's going to end up being like that. Carrie's saying, does Bellafill help with dense cause of pimple injection? Yeah, it could definitely help with that. So it could actually be like that. Let's see here. Evilizing, is fat transfer better than filler for acne scars? If you have a lot of volume loss, then fat transfer may be the best option. It just depends on how much volume loss you have. Let's see here. Medina saying, hi, Dr. Qazi. I've done the Cure laser and will love to come in for scar treatments when I can. Well, if your acne is under control, first of all, glad to hear the Cure work for you. If your acne is under control, then what we could do is we could end up doing a consultation. We'll set up and see if we're ready to do scar treatments. Let's double check to see. By the way, are you guys able to hear me okay? Some people were saying that the mic, they couldn't hear me properly. Hopefully you guys can hear me. I tried to get it closer to myself. Hopefully that'll help. Brian saying, cost of procedure for acne scars like your third pin video local in SoCal. Most patients spend about $5,000 to $7,000 on their scars. Most about $5,000 to $7,000. User 65 is saying, do you do 50% off acne scar, TCA scar, and Bellafill if we are back again? You do get the 50% off for the TCA cross and the laser, but the Bellafill is just a regular normal price for Bellafill. How long does Bellafill last? Good question. Bellafill basically is made out of cow collagen and PMMA. The 80% of cow collagen goes down over the course of about 3 months, and then it basically triggers your body's natural collagen around the PMMA, and it continues to regrow, basically. That's how it works. It works incredibly well for that. So it's great for scars because you always have some nice support there in your tissue. I know I missed a few questions here, so I'm going to try to see if I can missed it over there. Xander saying, can't wait to share my results with you, Dr. Qazi. Look forward to it also, Xander. Look forward to it. Let me know when you could. By the way, I had multiple follow-ups today, this whole week. Last week has just been like amazing that we had so many people that I saw from a month ago already. Their skin looks incredible. People have been really, really good. I was a little bit worried. I've been talking about this, that the sun was like, it was just like 109 degrees, things like that. Some of my patients are also in Arizona. I have a lot of Arizona patients actually. Texas. It's so hot, and they're still so good with sun exposure. My Florida patients, actually, I had a Florida patient I followed up with recently, I think from Fort Lauderdale, I believe, and still looking amazing. You know, super hot, humid over there, still did a great job. So it really is possible if you avoid sun. You don't have to get pigmentation issues. It really is. Just be really good with that. Underrated saying, I will see you soon, Dr. Qazi. I already had a consultation with you. Look forward to it, Underrated. Really look forward to it a lot. Hopefully we'll see you soon. I know I missed a bunch of questions, but I'm going to try to catch these. Let's see here. How many TCA cross are needed? For deep ice pick scars, usually 4 to 6 sessions, usually for deep ice pick scars. It could take a little while. How much is laser only? I almost never do laser by itself. It could be about $3,000 to $5,000 depending on what we're doing for that though. Let's see here. Hello saying, have you seen any adverse results from Subcision laser in your practice? There are scary stories online. Not with Subcision. Laser, just redness for a little bit longer, but nothing special really with that. Really pretty mild. Nothing that's like long lasting. It's never like, I would say that sometimes there's could be some pigmentation, some hyperpigmentation, and occasionally even some hypopigmentation in some patients, but it's never permanent. It's something that tends to go away just after a few months. Sometimes we may give a little bit of medication just to help with the healing process, but it usually doesn't end up having to be much of a problem with that. And Subcision is really not much of a problem at all with me. You saw the way I'm doing it. I'm really focused. I'm really localized in some areas. I'm not trying to basically try to go and use a blade everywhere. So really, really select areas, and that's what I try to do. Do you have much experience using a forehead rolling scar? I do tons with forehead, tons. I do so much forehead filler, Subcision forehead. I do a lot with that, so I'd be happy to help you out with that. Can we get chemical peels before the acne scar combination treatments? I would not recommend that. Just leave your skin alone before you do that. We prepare your skin beforehand. We do it so we can do it safely, so don't do that actually. I know I missed a bunch of, actually I know there's some other formats. They don't let me say where it's from, but I know there's a bunch of other questions. I'm going to try to catch those ones on the other places that we're streaming to. Let's see, your acne scar filler healthy long term. Yeah, so Bellafill is healthy long term, so that's a great option for people. Radiesse is a good option. Sculpture is a great option. I just want people just to do things to improve their collagen. What's the downtime for Pico laser for melasma? There's no downtime. By the time you get to your car, you do your treatment. By the time you get to your car from my office, it's going to be relaxed. There's going to be less redness. It's going to be fine by the time. And also, just by someone was asking about the chemical peels process for scar treatments, there's really no reason to. You're going to get exfoliated. I'm going to exfoliate you when you do your laser. You don't have to do anything more than that. Can you talk about Cosmelan peel? Yeah, it's a good peel. It's really, really nice for pigmentation. They sort of changed their protocol right now, so I never really have been dependent on it because it's sort of sometimes it could be a home run for some people, things like that. But I do find that doing it combined with laser could work incredibly well. And then for melasma patients, it does work really nicely because it doesn't I find that it's effective because it's not as aggressive as something like the blue peel sometimes that can end up happening, where the melasma rebounds right back. I think it does a good job of suppressing it afterwards. So I think that's really good. How much is TCA for the face? Usually about $800 or so. Our prices, by the way, most of our prices are on our website, drqazi.com. So go to my profile, you'll see our prices. Just go through there, you'll be able to see a lot of them actually. And then hopefully that'll give you some idea. Usually, like I said, most patients for scar treatments is about $5,000 to $7,000 that they're spending on their case. And I do a ton of this. I do so much with scars, but I also do a lot with the collagen, a lot with just overall improving your skin, tightening your skin. I do a lot with that. So, there's a solution. Whatever the problem is, I'll be able to help you out with it. And I want to make sure that we do it at a very high level, and we're not doing it where it's something that's nonsense type treatments that people have struggled with. My patient today, they came in consultation, did so many clear and brilliance, did so many different lasers, all these things. Nothing worked for the scars. His deep ice pick scars. So that's not going to work like that. Do you like microneedling with Sculptra? It's good. It's better than regular microneedling. I can say that. Alice Waters saying, is it true that you offer 55% off for people who are already your patients? Yeah, it's true. It is true. You're part of our warranty program. I'm the only place that's ever going to do that. I'll tell you, honestly, I've said this before. I'll tell you again that I wanted this. I wanted to kind of demystify. There's a ChatGPT word that I kind of just went wild. ChatGPT is like going nuts with like demystification all the time. That's me actually saying it. Demystifying. I wanted to say that a lot of people seem to think that this has to be so expensive, and because I do so much of this, and I really, really understand how important it is to treat scars. I really wanted to make sure that, first of all, when I do that first combination session, I'm knocking out of the park for patients. And you have a patient right now, Alan Mendoza is just on here, coming on here. He did a single session, or now he's a two, but the first session he did, I'll show you his result, and you can see single combination session, what we could do with patients in improving their scar tissue under a single session. It's like something really critically important to me. Now, obviously, everyone's collagen response is different. A lot of people have different kinds of scars. I get that. But I still, at least from my end, I want to feel like I did enough. I worked really, really well and making sure that we can maximize the result. And I've achieved that. I could say universally, I feel really comfortable that every single time I tried to knock it out of the park. Well, this got really, really big. Let me try to minimize this a bit because it's covering up the whole screen. Let's see if I can minimize this guy. Just bear with me a quick moment as I minimize this result. You guys have seen this on our feed as well, but you can see this result, amazing result. This is a single combination session. I'm going to show you this for everybody that's looking at it widescreened. I'm going to try to make it as small as possible, but you can still see the scars. Let's see if I can fit everything in here. So if you look at his scars, very, very severe scars, very severe. This was initially after a single combination session, although now when the day he came in, we ended up doing some more Bellafill for him, as well as TCA Cross. You can see significant improvement of his skin after that single combination session. So that's something that I want to showcase for people, because a lot of people don't seem to understand that when I'm saying it's a single combination session, I'm trying to achieve these kind of results for people. This is what I'm trying to do. Actually, I got to double check. I don't think that we did filler this day. Alan, did we do filler this day? I can't remember. I don't think that we did filler. I know we did a dilute form of Radiesse through the laser channel holes, but we didn't do actual filler. I don't know if he's still on. Alan, do you remember if I did filler at that time, the first session? And I believe we did it the first time. We did it in like end of February. Is that right? Alice Waters saying it's truly very expensive. I'm a student and have spent $25,000, no result, worse scarring. Well, I'll be able to help you out, Alice Waters. We'll be able to help you out. We haven't actually announced it, by the way. I'll tell you guys that are online right now who stuck with it. We're going to be doing something right now. We're going to be doing something really cool. So if you do a consultation, everyone was asking, students were asking me for discounts, things like that. But I'm going to do this for everybody. But basically, if you do a consultation with us, the consultations are $100, but you're going to get $200 back for your treatment. There's our deal. I'm going to announcing it here first for you guys. Everybody live is going to know this, that we're announcing this. So you guys can get a head start so you can book. I'll tell you right now, this is our busiest time right now. Everybody's booking for fall, winter time. So call us tomorrow or schedule it. The easiest thing right now after this live, go on my page and schedule it directly. Just go through my page and you'll be able to see on drqazi.com how to schedule it right there. And I would highly recommend doing this because you can right now. I don't know how long they're going to do it, but they haven't even announced it on Instagram or anything like that. I'm just announcing it. Sometimes I have these meetings. They have a meeting with me, and I'm like, oh, okay, cool. And then I'm like thinking about it, and I'm just like, let me just announce it during the live, and I'll just tell people about this right now. So here you go. If you do a consultation with me, you'll get $200 back towards your treatment. There you go. There's a killer deal. Now that's going to be work incredibly well for patients for the scars. They'll give you the terms, all that stuff later on, but really. Scar treatments, you guys know the cost, but you're going to save yourself now $200 now by doing it. So not only are you going to be able to get a killer result like this, but you're going to be able to afford a little bit more. It's going to be a little bit more affordable for you too. So everyone was asking constantly if I could do something more for the live people again too, and so I was like, here we go. So yeah, this is your yellow. This is after a single session, and we could end up helping you out a little bit more. You know, he came in again in July. We ended up doing more. When he came in, we did some Bellafill that day. We did TCA cross that day, and I believe we did a laser as well. But he needs more work. You know, his scars are very, very thick. We're gonna have to do a little bit more. We're gonna have to do a little bit more of the Bellafill, particularly. We'll do all that there. What's the benefit of Cosmelan peel over something cheaper like VI peel? Cosmelan is far superior to VI peel. Sam Rue is saying, does TCA cross do always scars look worse for a few months? Not always, no, not necessarily. Sometimes just in the first month it may, but after that it does calm down. And Dicino is saying, I got a double chin lipo and TJ for less than half than what you charged. And you told me it wouldn't last. It's been 3 years post-surgery, and I'm glad I didn't spend an eyeball doctor. Okay, awesome. I'm glad you're happy, Andy. I'm not sure why that's something to come on here to talk about, but okay, cool. You got chin lipo in Tijuana for less than what I charge. Cool. I'm glad that worked out for you. That's nothing. There's nothing wrong with that. But it's also I know how much work is involved when I do things. I think my prices for things are very fair and very affordable for people. What it ends up happening for people is that sometimes there isn't enough skin tightening. So I do a lot with skin tightening. So when I take out the fat, I also tighten the skin. So I don't only just take out the fat, I do a lot with skin tightening. And that's what I was referring to, that I may not last because a lot of times you have to do skin tightening. So, and I do some of the most skin tightening in the country. So I do a ton of skin tightening. I'm happy to do a lot of skin tightening for patients because I really strongly believe that after you remove fat, you really want to contract the tissue so it doesn't get loose afterwards. Bao Kimi saying, my consult is next Monday, but you have one more cure treatment to go. Should I reschedule? Well, if your acne is under control, that's fine. Then we could do it then, Kimi. Let's see what's happening with you. Let me know if the acne is not under control, then let's push it back till later. It depends on that. Harris is saying, a Canadian doctor sold me a package of 6 Infinities, so unethical, 0 result. That's really unfortunate. Honestly, I would not recommend that at all for somebody, especially it's like really arbitrary, random to say that for scars, you need 6 sessions. I do scars all day long, and I don't know how many sessions you would need for that because a lot of it depends on your collagen response. I don't know. I'm not sure how long it's going to last there. So just so you know, I personally, what I end up doing for scars is I do those treatment, and then I see our collagen response, and I see what else is needed. A lot of times I do know that we're going to need things like collagen in the future. We're going to need volume in the future. But we also have to wait. I have to see after I break up the scar tissue, do subcision, what else we're going to need to do. Apples and Oranges saying, have you ever considered using silicone microdroplet injections instead of Bellafill? Not really, because honestly, we actually removed a lot of silicone in our practice in the past from places that people have done elsewhere. It doesn't stimulate collagen. It shifts. I've seen a lot of silicone that just shifts. It's not exactly where you place it, so it's not something that I'm really particularly going to love. I really do like Bellafill because it stimulates collagen. Nothing really beats that collagen production there. What's your opinion of Accutane for scars? Well, it's going to help produce some collagen production. There's no question about that. So I think it's good for that. But I don't think that it's really going to help enough for especially for these kind of thick scars. It's not going to help enough really. But it does help with collagen production. So I think that's really good for that. No, I know I missed a bunch of questions. Maureen saying my consult is on Wednesday. Awesome. Looking forward to you, Maureen. Let me know when you come in that you popped in. And G, appreciate you coming on too. Let's see here. User 64 is saying, how many sessions will you need for PicoSure for melasma, and do you run any specials? Well, PicoSure is not really much of a special because we also, by the way, have the lifetime program for melasma. So future sessions for Pico, after you do your sessions for clearance, you use 6 months worth of work. Then it's actually 55% off for future Picos, just so you know. Samru saying, does erbium laser cause fat loss on face? I've seen many people talk about laser and fat loss, and hence I am concerned. Erbium is really low heat, low energy, so really low likelihood of anything like that happening. Even for CO2 laser, you really have to stay in a small localized area to cause that. I don't see how that's going to be possible elsewhere. Is the watermelon discount still valid? That was for a short period of time, but if you already took that screenshot at that time, then you could use it for the future. But that was at that time. Now what we're going to be doing is we are going to be doing that for the consult. So if you do the consult, you could now get $200 that's going to be towards your treatment. So spend $100 on the consult, give $200 now towards the treatment, just so you know. So awesome. That's going to be really helpful for a lot of people who are asking for deals. I know everybody's talking about it. Everybody knows it's a stressful time for some people, things like that. Here to help too. I want you to still have a really, really killer result even during this time, because really when you look at yourself, this is something that you could control, you could feel better about. Yeah, it's something that I think a lot of people otherwise can feel like there's no hope. And it's really nice to be able to have something that's going to, that you could look in the mirror and see over time it's getting better and better and better. I want everybody to experience that and feel that, really. I also talk, you guys know, I always been saying that, sorry, G, the money's been stressing G out, she says. Stressing everybody out. The problem is that it's like there's no question, absolutely no question at this point that the inflation's way worse than they pretend. It really is. I think that everybody knows that. I try to keep my prices the same. I actually have hardly moved much of our prices at all. We've hardly done that. I try, just because I'm not like a grocery store, just because there's more demand or something like that, we're going to try to jack up the cost now. Did you guys hear about that, right? Like they're saying that on warm nights, on hot nights, they're going to jack up the cost of water or things like that. It's outrageous. It's ludicrous that it comes out like that. I'm trying to fit everybody I can fit, all the demand that I have. I'm trying to put everybody in there and do everything that I could do and continue to do that at a really, really high level. And I also want to help out people that are just like suffering. I get it. Like, there's a lot of suffering out there with the scars, and if I could help alleviate some of that suffering, it makes me feel good. It makes me feel really good. It's like a little thing that like I've been able to chip away at and continue to chip away at, and it's really, really nice. And it makes me feel really, really, really good every single day that I do this. It's like it makes me feel really good, because it's like everybody says, what can you do in this world? The system is so bad, blah 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 blah, and it's like nice that in my little world, in my world of acne scars and the aesthetic world, I can make a difference within this world, and I can help adjust things and keep pushing things forward and make things better for people. And it feels really good to be able to do that. It really does. It's like, it's a great opportunity, and I know that it's a lot of responsibility as well. I know it. And it's amazing. And it's like super fulfilling, because it's like I get to do something with my hands. You guys know I always talk about it. I love to use my hands to work and things like that. I've always liked to do that. And it's like I'm able to do that. I'm connecting with people that suffer and help them go through a suffering process where I really hope people could feel less lonely. And that's one of my ultimate goals in life, is that people feel less lonely. I think scars cause people to feel lonely. And I want us that people no longer feel that sensation. I want to feel like they no longer have this burden that they see every moment of their that they look at the mirror, and instead they just feel like a lot lighter. They may see a little bit of that scarring, but they know it's no longer as visible. They know that, you know, when they're at the grocery store aisle, that somebody's not looking at the same way they used to. They know now that their coworkers are not looking at it. They know that their dates are not looking at it, and it feels a lot better for people. That's what I want to get to. I want to have that for people, so they no longer feel that way. That their self-esteem gets better. I would love for that. I would love for that to happen, because I really do feel that there's so much suffering out there, especially due to loneliness. And loneliness, there's multiple different reasons why people are lonely. But one of the things that I've noticed is people with scars, people with acne, people with pigmentation, people with facial sagging, things like that even, they start to feel more lonely. They start to look at themselves and wonder what could have been. As they get a little bit older and they're losing fat and volume that used to support the scars, they start looking at it like, this is just not my face anymore. What is this? I want to get back to myself. I want to go back to how I used to look. Almost everybody universally who does these treatments and does things with me, they still want to look like themselves. Nobody says, I want to look like somebody else. You know, and maybe rarely somebody used to show me like Madison Beer or something like that and be like, I want to look like Madison Beer. But like, we got to really talk about that and really explain that what we're trying to do is enhance your natural features. I want to basically get back to what you should have looked like. Acne and scars robbed you of how you're supposed to look. You know, pigmentation, especially like something like melasma, it robbed you of your skin. These are things that took something away from you. It wasn't your fault. Didn't do anything wrong. So many people look at somebody like this patient over here and think that that person made a mistake because they actually picked at their skin, or they should have been an Accutane, they should have done something else. First of all, there's so many different reasons why somebody couldn't do Accutane. There's so many different reasons why. Whether there's medications that they were on, whether there's side effects like depression that they were worried about, you know, or just access. You can't say this in a country, you know, that this person should have done this, when we don't have free healthcare. You know, when people don't have, you know, I prescribe medications all day long, and insurance companies fight me on this every single day. When I try to prescribe something like a Cleef, I like it, I want to prescribe it, I want to use that as a retinoid for patients. And insurance companies reject it left and right. They reject it, and they try to charge patients $800 sometimes for these creams, and it's just made up, this made up amount of money, and it's outrageous to me, the system. And then somebody's going to have the audacity to look at someone like this patient and judge them for not going to someone beforehand, and that is terrible. So I want to, you know, of course, I want to educate people to stop judging people for that, of course. But I also just know that there's a lot of people out there, and there's a lot of people who do judge that stuff. So it's going to be really nice if we could help soften those things and make it so it's not as visible for you, so you don't have to feel like you're being judged so unfairly for something that was totally outside of your fault. And you know, think about it. You suffer from acne when you're 16 years old. My patient today, he had very, very thick scars, very, very thick scars, and he had them when he was 16 years old. It destroyed so much of his cheek area, his lateral cheek, his temples, just like nuked some of those areas. I broke up that scar tissue so well, broke up basically 2 decades worth of scars. First of all, it's cathartic for me. And I don't know if you're on right now, but he was like, this is cathartic. He's like, this is awesome. I was like, I feel like it's cathartic. I feel like it's like really, really nice. It's rewarding to really break up the scars, but I love it when patients also feel that way. So it's really nice. Ali is saying, does laser alone help with hypertrophic acne scars on neck and chest if most are skin colored and very, very old? Not necessarily. You could just do pigmentation and like it's something for pigmentation, and you can do steroid injections. Something like you could actually do a little bit of steroid, but then sometimes we may, if it's red, use a little bit of a laser like XLV works well. Ali is saying the worst comment I ever got is you really should be more clean and wash your face every single day. Or I get asked if I had chickenpox. Yeah, it's so unfortunate. It's so unfortunate like that. You know, I had terrible, terrible acne, and one of my uncles said, was quizzing me, and I did everything at this point, everything that I possibly could. He's like quizzing me, what is the latest on acne vulgaris, and what are you doing before it, because you're not because clearly you're not washing your face enough. And it's like, you know, wanted me to go through like the latest research in acne vulgaris, and mind you, I was like 19 years old at the time, and I did do everything. Actually, I did know a lot with acne. Anybody with acne and scars and like pigmentation, they know a lot. I really researched the subject a lot, and so it's like we did everything right, and it just, my hormones were like wild, and that's what it was. It really was just my hormones. It wasn't my fault. I tried cleaning and doing everything. Although I will say this, I do think that I was steered the wrong way. I do think certain things made things worse, but I didn't know any better, and I wasn't told that like dairy at the time could have triggered it. I drank a lot of milk. I probably should have cut back on that. I wish I knew about that. That would have helped me out if dairy wasn't a thing. Let's see here. OC saying, I just had my fourth cure. I'm still breaking out primarily in my jawline. I'm a guy. Why would that be? Well, it's still probably hormonal. Jaw sometimes a little bit a little bit longer. One of my male patients that I worked on about a week ago, he was telling me that by far there's a huge difference between the 3rd and the 6th month after the cure session. So really, it's a matter about being patient, to be honest with you. If in the meantime, though, we may want to do a lot more with antimicrobials, antibiotics. So it's topical, dapsone, clindamycin. Those are potentially the things that we're going to really help you out with it. Let's see here. Yes, I hope it is. Yeah, it is a home run. She's saying that she hopes yellow's result is a home run. I do hope it is too. I think it's going to be, we're going to be able to solve that there. Molly is saying, you seem to read us very well, doctor. Thank you. Yeah, I pride myself on that. I do think that I have a pretty good sense of what's going on with people and how they feel, and really just like how they're suffering too. I really do pay attention to that. I did want it so that people do see enough improvement in life, and they do feel like that they could close this chapter in their life. It'd be really nice. It's really nice, and hopefully then you could kind of pass it along in whatever industry you're in. Whatever you're doing, I just want you to like solve a problem. Like look at the problem that's like kind of global with people that you feel like you could potentially help. Like what's your skill set that could help out people? There's something, there's something that's there that you could potentially help out people. And it's like, let's figure it out. Let's figure out what that skill set is. And like, I want you to first obviously help yourself, because you're not gonna be able to help other people out until you help yourself and be in the right place, and that you're doing the work that like is really fulfilling for you, really exciting for you. When you're doing it, it's like something that is, connecting with you really well. For me, it's like using my hands. That's what I was talking about. That, like for me, it's like creating and building and doing things like that. I like repairing skin. I like repairing things in general. I like taking things apart and rebuilding that. It's really fun for me. So that's where it's exciting. But whatever it is for you, like decide. I'm not sure, and do that, and then eventually see how that's going to help people. For me, I thought that one of the biggest problems in the world is loneliness. Really. So I was like, I'm going to try to work on solving loneliness in multiple different ways. So one way right now is with this, but there's a lot of different things I'm going to work on with that. There's a lot, because I think it's something that's going to be really wonderful. If people feel that they are, at least right now already, they are part of a community, they're part of the scar community, part of the acne community, part of the pigmentation community, and there's other people that suffer with them, so maybe it's a little bit less lonely just by knowing that. And then on top of it, I want it so that beyond now this, as your skin heals, as your skin gets better, you feel more comfortable and confident. Now you're opening more doors, and you're feeling like, just because in the past you would have felt that like somebody rejected you because of your scars. Now your skin's looking good, and maybe it wasn't really quite a rejection. Maybe it was just a misunderstanding. Maybe it was just something else that was going on in their life, and you kind of were projecting a bit onto them. And because of you were just so insecure, because of that you suffered so much from your scars, because you were bullied, perhaps something else happened, and now you just get more sensitive when people don't hang out with you or they aren't calling you regularly, things like that. But maybe you should try to call. You should try to do those things, and you should just be more grateful about things. And you're going to now have the opportunity to be grateful because your skin's more healed, and you're going to be able to do that. Nothing's holding you back anymore. This is no longer holding you the way it was, holding you back the way it used to. That's going to be amazing for you. That's going to be a wonderful if you be able to have this, and this is no longer something that you have to suffer from, and now you can be able to achieve a higher level. That's going to be awesome for you. And I hope we can achieve that. Hopefully we can be able to get that where you feel like, yeah, you're really a lot more comfortable and confident in your body, in your skin. And now it's like you no longer have to have something like that. I am him saying, I have very severe atrophic acne scars. Do you recommend laser or microneedling? Maybe neither. We'll have to see. Sometimes we break up the scar tissue, do subcision, do volume, things like that, but maybe neither. Definitely not microneedling, I'll tell you that. Can this be done on the nose? Yes, it could be done. It could be done on the nose. G saying, I like encouraging people. That's awesome. Yeah, just that's the thing. I do like that too. You know, I want people to feel better about themselves. I want them to feel like just there's hope and opportunity in this world. You really should not feel, I don't want anybody to feel like there's no hope in this world, really. You know, I want everybody to always realize that it does get better, that things do get better. No matter what, it really does ultimately get better. Like I could say safely for myself that every single time, every single moment, it really has been getting better and better in life. And it's like pretty cool when I actually look at it that way, that like life just continues to get better. And it's like, okay, I want more people to experience that. Because at one point you didn't realize it. Like at one point when I was 16 years old, you're sitting there, it's like, it looks like this is it. That's life. There's nothing else there. It's like there's nothing. It's like there's no point. There's no more point. And you sit there and you think to yourself like those kind of things. And it's like, man, it would have been nice if myself like was able to talk to my 16-year-old self and be like, hey, it gets better over time. It's going to be better, and it's going to be really cool when it does, and it's going to be really fun when it does. And you're going to be able to connect everything. That's going to be cool, right? Wouldn't that just be like an amazing thing when we eventually do? I think it's going to be. Thank you, Anju. Yeah. So I think it's going to be fun when we ultimately get there. Like I think all of us, when we do this, it's like going to be fun that we like can feel more positive and we've connected with our work, connected with people. We're doing things for a positive change. I've always said that, you know, it's not like we're doing things that are destroying people's lives, things like that. We're not taking away people's, we're not sitting here like we're the eviction police or something like that. We're trying to help out people, trying to make people feel better about themselves. And like, it's like really rewarding. That's awesome. Just keep doing that. And, you know, there's a lot of people that I see, and it's like, it's really fun just seeing that positive, the positive outcomes that we get to achieve. I'm going to finish up with something here. Someone saying that they had a question. I missed it though. They said, Ara saying, I really want to start the process to heal my acne scars. Well, what we should do is actually just go through my page. And then right now, we haven't announced it, but I'll tell you guys ahead of time. If you spend the $100 for a consultation, you'll get $200 back for your treatment. So just so you know, that's something we're throwing out there right now. So you spend $100, you get $200 back just for that. OC saying, you're motivating me to pursue nursing. Your doctor words mean a lot. I hope so. Yeah, nursing is a great field. Just like heal people, help them out. There's a lot of people that help with that. Ali is saying these scars really run deep, and it's not just about looks or aesthetics. It's a big part of managing mental health, even after the physical scars have faded. Absolutely, it is, and that's something that we really have to work on too. Is just the mental health aspect of all of this. So I would love to help. And just little bits that I've seen to improve my own mental health too, and just get into a better space for us. I think it really helps out with that. Let's see here. Someone's saying, do you have to wait to do acne scar treatments after finishing acne scars, Accutane? Not necessarily. It just depends on the dose that you're on, and then also if your acne and your oils under control. That's what I really want to pay attention to. Do you do mini facelifts? My partner does that, so feel free to schedule a consultation. We'll be able to help out with that. All right, guys, yes, I do online consultations on Zoom all the time. We can schedule that as well. Let's see here. I know I missed a bunch of things, but anyways, guys, appreciate you so much. I will see you again tomorrow night. Let me know if there's anything particularly interesting that you want me to go through. Hopefully we will hit up some more subjects like that. Any other topics you want, let me know. You can always DM us too, or just comment on there what other things, some questions that you need. All right.